Dr. Dona Murphey is a neuroscientist and a neurologist. She joins us today. Dr. Murphey, we heard about brain fog and how it feels, but how common is this? Is it something that's unique, or are more people having it than we think?
Eric and I are both part of a group called Body Politic, which is one of these patient-led research and support and advocacy groups, and they are really committed to, patient-centered research on the topic. And from the preliminary studies that they've done, it appears that within the first couple of months, about 70% of people are exhibiting issues with concentration. Many of those also report that they have problems with memory, namely short-term memory or working memory. And the numbers appear to go up pretty dramatically if you look like 6-7 months out.
Dr. Murphey, you had COVID in March, and you say that you're having some lingering effects still. Tell us about them.
My initial infection lasted about 28 days, and I was in bed for pretty much that entire time, not because the symptoms overall were particularly disabling, but because I had one particular symptom, which was like this episodic, like profound drowsiness that would just require that whenever it would happen, I'd have to go to sleep. I found it difficult at that time to multitask. And the other difficulty that I recognized was in my writing. I was having trouble finding words. As Erica mentioned, I was having trouble substituting words. Yeah,
Erica, you were nodding your head when she said that she was having difficulty multitasking. Are you having the same problem?
Absolutely. Honestly, a lot of times I have difficulty just even doing one task because it's the steps. They're hard for me to keep focused and in my mind. So what I've taken to is I will end up having to write down each step in a process and put them in order and just kind of keep referring back to the paper, because if not, I get confused.
Sure. And Dr. Murphey, you said that your symptoms went away for a little bit, but then they came back.
Yeah, so after that first 28 days, I had a period of remission of about 3 weeks where I was pretty much back. And then in late July, I noticed that I had some worsening of my cognitive symptoms, and it was also actually some new onset psychiatric symptoms. And this happened at about the same time that I started experiencing chest pain that was very mild but present. Right. And difficulty breathing on exertion. I ended up having this sudden onset, what we call alien hand syndrome, which classically is like this perception that your left hand, typically it's your left hand, doesn't belong to you, and it moves on its own volition. For me, and I think for most patients actually, alien hand syndrome manifests as like a feeling that you're estranged from your left hand, or that you have a tenuous relationship with your left hand. And that's more of what it was for me. But it was sudden in onset. It lasted for about a week, and then it dissipated. And it would come back for a little while thereafter when I was stressed out or when I was sleep deprived. And this is a pattern that's very classic for stroke. And because I had no other symptoms other than that was sudden in onset, because the cognitive and psychiatric symptoms were actually more gradual in onset over those, that first week or something.
Did you feel like, was your hand moving on its own, or you just felt like it was just detached from your body? It was just a sensation that was not part of you anymore?
Yeah, so it was perceptual. So I remember precisely what I was doing in that moment that I realized it. I was texting, and suddenly I was very captivated by my left hand and why it was in the orientation and position that it was in. And I knew cognitively why it was there in that way, because I was texting. But for some reason, I was just so interested in it, and it did feel like it didn't quite belong to me, but I knew that it did.